We good? Okay. So let's go to dentures. So dentures, kind of like I was talking about, really, really good for interims. They've worked really well. Predictable. They have, I haven't had one break yet. I haven't had a patient complain, and they reline just fine. So I'll show you a couple different types here. So you can get pink resin, and you can literally have a tank of pink resin. And you can have your white resin, and you can print separate pink and separate white and literally glue them together. So Blue Sky has that feature built in where you can print out a white chain of teeth that has literally, like, it fits in the sockets on the pink base. And so, like, here's the pink being printed. Now, I didn't even jump into this. I just, Corey was kind of like, kind of like monolithic, but try what you want to try. And I think monolithic's been great. But if you guys want to get into separate pink, the aesthetics will be a little bit better on the pink aspect. If you're really trying to do conventional, like permanent, you'd probably have to go print the pink. But I still kind of think this is more just for interim dentures. But if you get to the point you're like, hey, I need low-cost dentures, I want to do conventional permanents, you probably got to get the pink resin. But for simplicity, all you got to do is get some NextDent MFH bleach, and that seems to be the best resin for printing monolithic. So they're going to come out looking just like this, where it's all just one. And this is kind of what I was talking about earlier with the supports on the intaglio, is you can grind those down and have a little bit of surface retention so that your reline material will stick to that. And then you've got to get some pink on the facial for most cases, because you might be able to get away without doing that on the lower if the patient has low expectations, but most patients are going to want some pink on there at a bare minimum. So I think monolithic's the way to go. It even has the ability to literally buy stock denture teeth that that Blue Sky can pre-plan for you to use stock denture teeth, and they'll have like a reduction coping where you can put the teeth in it and hack off everything that sticks through, and then set the denture teeth inside the printed denture that's been ready to accept the teeth. So, I just don't really see the need for that, but it's there. It has the ability. So, monolithic, separate printed white, printed pink, or you can use the stock teeth with the printed pink bases. There's various ways to get the pink. You can stain it, or how we like to do it is lay some of this pink triad material on the facial. It's called Triad High Flow. So if we got, I don't know if I included a picture on that.
That picture was painted, right?
Was painted, yeah. So those are, you can do pink composite, you can do pink stain. These are pink stains here. But there's pink composite, pink stain, or using the pink Triad High Flow. So my suggestion would be get some Triad High Flow, and then we like the stain and glaze kit on eBay. It's called it's called the Top Stain on eBay. Top Stain Air Stain. It's just cheap. It's easy. You can get a whole kit of it. There's glaze that it comes with. The glaze is literally just paint on and it air dries, and it gives like a nice lacquer to your restorations, to the dentures. So the kit, you can get it with your browns, your yellows. You can get it with the blues and the whites, and then the pink. If you want to just paint on some pink onto your denture, onto your white denture, and then throw some glaze over the top of it, and it works pretty well. But the Triad High Flow is you guys use Triad. It's a little bit stiff, but the High Flow is just really much more putty, and it can kind of smush into little areas. So you can just use a small strip and just lay it on the facial up there and just kind of smush it in.
Is that easier than painting it, you guys find?
It's not hard.
I think so.
Yeah, it's not harder. It definitely looks a little better than just painting it.
It does.
It looks a little bit better, but
It has little fibers in there, kind of like the vascularity of the gingiva too. And if you paint it, I don't know, we must not be artistic enough.
Yeah, the painting doesn't look as good, but it's quick, and so if you just need some quick and low expectations painting, the Triads is really easy to do too. Just roll up a little strip and smush it on, smear it on, and light cure it.
You can get fancy and do both too.
Yeah.
That's why we get the bleach shade. You can always make it darker or more yellow, but
Yeah.
you can't go the opposite way.
Sorry, you said the Triad High Flow, and then what was the other thing that you put on the
It's called Top Stain Air Stain, I believe it is.
I feel like any resin stain kit should work.
Yeah, any resin stain kit is going to work. This is just seems to be
And that's for staining the Triad after or something?
so that you can stain the white teeth.
Oh, I see. It's either that or the Triad High Flow.
Yep.
Okay.
Top Air Stain. It's called Top Air Stain, and it's on eBay. They've got kits where you can get all the kits. You can get the teeth color stains to stain the teeth a little bit darker. So that's why we like to say get the bleach shade crown and bridge material to do the dentures, because it's uber white, and then you can always just stain it down a little bit and then put some glaze over it to make it nice and shiny. And so we use that for like temporary implant crowns, the dentures, and that works really good.
Is the glaze just a light cure too?
The glaze is self-cured, and it works really well. You just paint it on. It comes with a brush. You just paint it on. It takes about 10 seconds, and it's already hard. So it cures fast. You don't need to light cure it, and it holds up well, and it looks nice. It's nice and shiny.
We tried buying A1 resin. Would you think we were a little disappointed by it?
For the crown and bridge.
Yeah.
Yeah, I think just getting the whitest resin
Yeah.
and then
Where
staining down.
patients care when you're doing a whole denture. They're like, "Oh, great, looks great, looks white."
Yeah,
Or,
yeah,
I'm not gonna care.
yeah. Just buy the widest material and then stain it down if you need to. So this is a little bit what we're going to dive into. We're going to talk about different ways to acquire the data. One of the easiest things when they come in with dentures, they already have teeth, they already have some vertical. You might have to change it or open their bite or tweak it, but you have something that you can A, take an impression in, B, capture a relationship, a vertical in, and then C, you can get some photos with it. So you know where the teeth are, and then you can ask for changes off of that. So it's nice when you have that, because when the patients come in with that and you can capture that, you can just take those and put them into like the box scanner and just get digital data right away that you can just run with. You could just send it to the lab and they can start working with that, or you can work with it in Blue Sky. So it's nice, it's nice when they have those. The cool thing about digital dentures, though, it's, when you get your models in there and you create these models, when you drag in upper and lower teeth, the teeth are already locked in a bite, and you're just moving a set of teeth within the arches. So there's no digital waxing up to have to do. You know how we were doing that this morning, and you're moving teeth, and it's a little tedious. This, you're just taking a whole row, upper and lower, locked in, and just moving it within the two jaws where they need to be. You don't have to sit there and dial in any occlusion. It's just already set. You're not, it's not like you're doing the analog way of setting teeth and trying to get everything in there. Does that make sense? So this would be like if you were printing the pink bases, and then you were going to go glue on the white teeth there. Generally, you can just print one piece and then stain the pink on, which I think works better. So this is what we're going to do. We're going to make a set of dentures.